Hi guys, welcome back to Your PTA. I'm Asher,
I'm Adriana.
And I'm Erica.
and today we're going to be going over a prone on elbows position. This position, first we're going to talk about some of the benefits. So the benefits of this position are going to consist of working the serratus anterior, triceps, and the erector spinae in the lower lumbar region. So I'm going to have Adriana lift up her head, and I'm going to be here to support her and just for safety reasons. So we're going to actually help her get up onto her elbows. So what we're going to do is we're going to just work on that weight shifting. So we're going to lean to our left side and slide this arm back and just repeat until those elbows are directly under our armpits for the most support. And here we're putting weight through the elbow, the shoulder, and that's going to help with healing, just encouraging more strength, and it's really a good benefit of this position. And you can see now that Adriana is a little bit relaxed with her spine, so her shoulders are actually retracted. So we want her to slide the shoulders out and push up into the back of my hand. Perfect. So this is activating that serratus anterior, and as well as she's using that triceps to hold her up. And then you can also see back here she's using that erector spinae to pull up and keep her chest up as well. And some precautions that we want to consider before putting a patient into this position is any unstable fractures, either in the shoulder or the elbow themselves, because we want to make sure that they're stable just so we can use weight bearing as part of the exercise. And the first progression of exercise we're going to show you today is just push-ups from the prone on elbows position. So I'm just going to have Adriana relax, and she's just going to push up into my hand. And then she can relax, and you would just do 3 sets of 10, or depending on how strong your patient is, maybe a little bit less if it's their first time doing an exercise like this. And if she's a little wobbly on this left side, I can be here to support the shoulder, just hold her. And then if she needs any help lifting up, I can actually reach under and help support her back up. And you can help by also activating the muscles by tapping the triceps and the serratus anterior at the sides to help extend and get up to that full position.
All right, guys, so now that our patient is able to progress and has mastered this position, we can challenge our patient a little bit. So what we're going to do now is progress to a little bit more difficult exercise. So what this exercise is doing is promoting weight shift through that right arm, also incorporating a coordination exercise on the left using the star excursion with the cones on the left-hand side. Also, it's promoting that joint approximation through the elbow and through the shoulder. So what I'm going to have you do, Erica, is we're going to lean over to the right. We're going to take that middle cone, and we're going to try to grab each and every one of those cones. So as you can see, she's leaning over a little bit. So we're going to stabilize that joint just so she feels that it's stable for her. Awesome. Now we're going to take them apart and bring them back out. Alrighty. We can do this about 3 sets of 10. Making sure that we're asking our patient how they're feeling throughout the entire time. If they're little gas, give them a break. But yeah, so that's an easy progression.
Hi guys, so now we're going to progress to rolling. And rolling is a very functional movement. Believe it or not, rolling is just the same as standing. When we're reaching over, working on separating the upper and lower extremity. So we're going to practice that in this position here. So I have Asher. I'm going to go ahead and have him lay down all the way. He's going to go ahead and extend his left arm straight. His axis of rotation is from his left arm all the way down to his left leg. So what I'm going to have him do, Asher, you're going to bring your right arm around. He's going to go ahead and use this right side. Did I say left arm? I mean right side. He's going to push through his weak side, and I'm going to be here to support his shoulder throughout the whole movement. So on the count of 3, Asher, what I want you to do is you're just going to start by letting your upper body roll, and then your hips are going to follow, and then your legs. I really emphasize pushing through our upper extremity. I'm going to go ahead and support the anterior part of the shoulder, and then I'm going to go ahead and give him a little bit of a tactile cue to turn this tricep on to help push through the floor as he rotates. Are you ready? All right, on 3. 1, 2, 3, and push through that arm. Push, push, push. Rotate. Excellent. Good.